Hey, I'm Dr. Wyrick. I'm the Clinical Director for Intermountain Regenerative Medicine, and I want to talk today about what's going to happen on your injection day. So when you walk into our office on injection day, our injection days are typically Thursdays, our staff will greet you, and you'll be handed just a couple basic pieces of paper, just your standard consent forms to sign before we do the injections. Now, we always like to take a baseline of your vital signs right then and there. So we're going to do things like your blood pressure, heart rate, etc. While we're doing that, my staff is in the back, our medical staff, our nurse practitioners are in the back, getting ready to sit down with you to go through that final step to make sure everything's safe and in proper order. Okay, so they'll take you back and then they'll start the preparation process. So our nurse practitioner will come in and they'll sit down, they'll talk with you, they'll go over your history again just to make sure that we've done our job on our end to make sure everything's safe. And then they'll start preparing your injection site. So if it's on a knee or shoulder or wherever, they'll start cleaning the area. They'll do a brief exam on the area just to make sure everything's good and make sure we use aseptic techniques so we don't have any risk of infection. While our nurse practitioner is preparing that, our office staff, they've been trained to take these umbilical cord cells out of cryotherapy, out of the cryo tank, and to warm them to make sure that they're still viable. Okay, our cells have been, each batch gets verified by a third party that once these cells are thawed, that they are still living cells, but they will take them and basically between gloved hands warm those cells up with a little bit of friction. Once they're thawed, we have about a 15-minute window for the nurse practitioner to actually inject those. So the nurse practitioner is doing your exam, getting you prepped. The staff is warming the cells, so by the time you're done being prepped, those cells are thawed. They are in the syringe, they are ready to go. Which brings us to the next question, does the injection hurt? Now, for me, it was an IV. I did this personally when I first started this. It's a needle. It's getting injected into your skin. Others have compared it to be very similar to getting an immunization shot. That's the pain levels that are involved. So once that's done, there's a small percentage of the people that we have that will actually get up off the table, they'll feel better and walk out of here feeling better. Is that placebo? Is it not? Don't know. But we do have some folks that feel a little bit sore for the next couple of days because we just introduced a whole bunch of fluid into that joint. And then for most people, they're going to feel like it didn't do anything until about 6 to 8 weeks out is when they really start to see a difference. And during that 6 to 8 weeks, our office will give you guidelines on activity because everybody's different, everybody's activity level is different, so we'll give you that personally so that you know exactly how to take care of yourself so these cells can continue to divide and grow and you can grow healthy new tissue. The sweet spot for these cells is really out between 6 to 9 months. So you may start feeling better within that 6 to 8 window. But 6 to 9 months is where they really start to take off. You really start doing well. And then from there, how long they last really depends on you, your activity level, how well you take care of yourself. So all told, on injection day, your time investment here is about 45 minutes. That's taking your vitals, doing the injection, taking your vitals again at the end just to be safe, and then sending you home. You're going to be here for about 45 minutes. So that's what to expect, and we hope to see you very soon. I appreciate you. Thanks a lot.